exciting. Now, a major review of the NHS in England has found the health service is in a critical condition with long waits for care, poor survival rates for cancer and a crumbling infrastructure. The surgeon and former Labour Minister Lord Darzi, who wrote the report, also highlights failings in social care, which he says has both a profound human cost and economic consequences. Well, Sir Keir Starmer will say later today that the service must reform or die. Our health correspondent Catherine Burns reports.
When dealing with a sick patient, medics can treat the obvious symptoms first. But to actually find a cure, they need to diagnose exactly what's wrong. That's what the government has asked this man to do for the NHS. Lord Darzi, a respected surgeon and former Labour Health Minister. His diagnosis is grave.
NHS, as we've heard from the Secretary of State, is broken, but it's completely reversible. As I said, the vital signs are stable. We just need to put the right investment in the NHS. We need to engage our amazing doctors, nurses, community staff in pathways of care and look at the whole pathway, as we've done before, from the cradle to the grave. What does it mean to the patients? What can we do to improve both the safety of care, the quality of care, but also the effectiveness and cost effectiveness of care?
Waiting is a big theme of this report. Waiting in busy corridors in A&E departments to see your GP. The list goes on. Waiting for mental health services, for routine surgery, for cancer care. Lord Darzi points out that the UK has worse survival rates for cancer than many other countries.
The report is particularly damning about the physical state of the NHS. Lord Darzi talks about a £37 million shortfall in buildings and equipment. He says if that had been spent over the years, it would have been enough to refurbish every GP practice, to provide up-to-date kit and to build the 40 new hospitals that were promised.
Instead, he says, we're left with crumbling buildings and decrepit porter cabins. He looks too at how things got into this state. He says it's partly a hangover from funding, with 2010 being the start of the most austere decade in NHS history. He's also scathing about a shake-up to NHS structures in 2012, calling it a calamity without international precedent. When COVID hit, the NHS cancelled or delayed more routine care than any other comparable health system.
We hear week in, week out from the patients who have been waiting 3 weeks for a GP appointment, from those patients who can't get a local NHS dentist, or from those patients who've been waiting up to 3 years for a hip replacement. What we need to see now is action to address those problems, and we welcome the scale of ambition being outlined by the Prime Minister.
Hello. Yes. Nice to see you.
The Prime Minister will say today that the NHS needs to reform or die. The question is how he's going to remedy it. Catherine Burns, BBC News.
Well, a lot to pick up on in Catherine's report there. Let's join our political correspondent Layla Nathu and our health correspondent Nick Triggle, who join us both live. And Nick, let's start with you, because this is being described as a scathing report. We heard some of the elements in it from Catherine. Apparently 3 big shifts will be necessary according to Wes Streeting. Just pinpoint the points that are critical for us to know.
Well, this report was commissioned by the government just after the election, and Lord Darzi was tasked with identifying the failings but not the solutions. So now it will be the task of the government to come up with some ideas and solutions to turn the NHS around. I think later we'll hear Keir Starmer talk about 3 key themes. They will be moving care out of hospitals and into the community, helping to prevent ill health so people don't need hospital care, and a digital revolution. Lord Darzi's report says the NHS is years behind the private sector in the use of digital technology. It also needs investment in scanners as well as buildings, as you've heard. So I think we'll hear Keir Starmer say that he will be putting forward plans for the biggest reimagining of the NHS since it was formed. But we'll have to wait until spring before we get that 10-year plan. And it's worth remembering these are the things that have been talked about for the past 20 years. Lord Darzi, in fact, produced a report for the Blair administration in 2007, pointing out many of these things. And I think the challenge the government will face is that it requires a lot of upfront investment to make a difference. And the problem is the growing demands on the NHS mean any extra money that is found often gets swallowed up, just keeping the NHS running from day to day.
Nick, thank you. Let's turn to Layla, because we've been hearing the challenge that Nick was describing there. We're expecting to hear from Keir Starmer a little later. What can we expect to hear?
Yeah, I think Nick's point about money is interesting, because I think Lord Darzi also, he talks about one of the problems having been underinvestment, then the impact of the COVID pandemic on top of that. So we're looking at potentially money for more investment. Wes Streeting's talked about new hospitals, new technology, but it's also clear that because money is tight, and they are at pains to make that point again and again about everything, they are trying to redirect existing budgets and stop money being swallowed up, as Nick said, by day-to-day spending, and instead being ring-fenced for investment, and so that can change the NHS in the longer term. Now, in terms of how much money there is to back up these plans, we're going to have to wait until the budget and the spending review after that, which will reveal the departmental budgets in the years going forward. But I think there is a political point here that the Labour government is blaming once again the Conservative Party for a legacy, specifically some reforms carried out back in 2012 by the then Health Secretary Andrew Lansley, which they think have been catastrophic for the NHS. I think also the challenge for Labour is to set out how exactly their long-term plans, their big bang reforms as they're putting it, are going to be different from those that came before, and aren't going to result in these unintended consequences that they say have been seen in the NHS. So I think plenty of challenges. As Nick says, it's going to be some time before we see that plan, this long-term 10-year plan. And I think also one other thing to point out is that Labour haven't come up with a corresponding idea of how to fix the social care sector. They've identified there is a problem with that. Lord Darzi in his report also says that, points out the number of hospital beds being occupied by people who should be getting social care instead. Labour have not come up with their own plan. They've talked about the idea of a kind of cross-party consensus on social care. They scrapped the previous Conservative government's plans for a cap on social care costs. There is a big issue in the social care sector in terms of the workforce, in terms of funding. So I think they're going to need to come up with a corresponding social care plan as well as these NHS reforms.
Layla Nathu, as always, many thanks. Layla and Nick Triggle there, thank you so much for just bringing us up to date and what we can expect to hear a little bit later on from Sir Keir Starmer. Of course, we also have a live page up and running with